Welcome to this brief talk on primary and secondary pain. The field of chronic pain and pain management was at an impasse for many years, in that since surgery and opioids were the only solution at the time, anything that wouldn't really take away the pain, and by those methods, there wasn't any other answers for people. One of the things that was perplexing to people managing chronic pain, people with chronic pain, was that they began to see that people with similar injuries sometimes would have very different healing times and recovery times. Some people would recover more quickly and get back to work and get busy and accommodate to their limitations. And other people had a much more difficult time of accommodating, and the pain persisted for a longer period of time and caused more of a disruption in their life with similar injuries. So there was something going on. There was the actual nerve impulse that signals pain and the actual experience of pain. And this is kind of considered to be kind of like a black box. We don't know what's in there, what's going on. Well, eventually, actually, some of the first patients that Jon Kabat-Zinn treated in 1979 at his at the stress reduction clinic he established at the University of Massachusetts Medical School, there were chronic pain patients. And they were, because the docs knew that they couldn't do anything else, so they sent them to him and maybe they'll help, whatever. Now, in 1979, he was considered to be quite a kook. But they said, well, whatever, we can't do anything more. You do whatever you want. We'll see what happens. So anyway, he would send these, he would take these patients through his 8-week program of mindfulness training, and they would have significant reductions in levels of pain from 30 to 60% just with the meditation practice. And the docs were going like, this can't be. So I sent him some more, 8-week program, same results, 30 to 60% reduction in pain levels. And what came out of this, as mindfulness continued to be used for people with chronic pain, was that we began to see there were a lot of other factors in the recovery process and a lot of other factors, mental and emotional differences between people who had chronic pain. That the people who had more emotional pain or more questions of why me, or I'm just not the same person I was, or maybe I can't provide for my family now, or I'm not as much of a man or a person, I'm no longer head of the family, or what are others going to think of me? I have to change jobs. But there's all these ancillary questions that would arise, which contributed significantly to the sensation of pain. So the more thoughts, the negative thoughts that somebody had about their pain, the more pain that they would experience. Which is one of the reasons if somebody has high secondary pain, opioids don't work so well. They still are effective to a degree, but they don't work as well as they could if it was just the primary pain. So one of the key components of mindfulness is that we learn how to maintain a present moment awareness. And when we do that, we're not thinking about the past, or isn't this terrible, how this happened, why this happened, why was I in the wrong place at the wrong time, and why this guy, I should have gone home at the time, or why did I, all those questions. And we're not in the future going, well, this is just terrible, that I've got to change my whole life, and what does my wife think of me, and or husband, or whatever. And that what's going to become of me, and why is this? I'm going to be sort of half functional the rest of my life, and those kinds of ideas. Those create a tremendous amount of emotional pain. And what we've also discovered that the pathways for the pain sensation are almost exactly the same for emotional pain as for physical pain. So all these worries about the future and remorse about the past just naturally accentuate and increase the sensation of pain. So when we're working with mindfulness, the practice itself teaches us how to recognize a thought and release a thought and simply come back to the present moment. And there's been some wonderful studies done on people who are meditators as opposed to people who are not meditators, that the response of to pain of people who are not meditators, there's a lot of anticipatory pain, and there's a lot of retroactive remorse or remembrance of the pain as a painful experience that continues the sensation of pain. Whereas in meditators, the tendency is that there's no anticipatory pain. And when the pain or condition is over, there's no continuing to dwell on it. There's no rumination. So in this manner, we can cut our pain levels down significantly, whether it's emotional pain or physical pain or both. And that it's really important to be able to recognize what the secondary pain from the primary pain. Because with the primary pain, we deal with it as we can. There's not much we can do about that. But with the secondary pain, we can greatly increase our sense of well-being, increase our ability to adapt and to accommodate and to deal with life simply as it is, not as we think it might be, or out of a sense of remorse or rejection for what has happened. So primary and secondary pain is important to understand, and it's what we deal with directly in the mindfulness meditation. It helps to train us to do that. So I hope this was helpful, and thank you for listening.